All right. Um, so today we just wanted to share some information. Starting about, gosh, in the summer of 2021, some of the leadership of the Center for Wellness at East Madison Hospital and Integrative Health um, started talking about how the degree of overlap in these and philosophy in both philosophy and services in these two programs. Um, And so we started coordinating and deciding, you know what, the integrative health program, was about a little over 20 years old. The Center for Wellness opened in 2015, 2016, and both programs really have a lot to offer in terms of supporting our patients and our community in terms of overall and whole health, thinking about how we can both best support people, not just in treating disease or managing disease, but really fostering a sense of health and what tools can we offer as a system to support health and wellness. So we started some pretty significant efforts at strategic planning in combining our programs because we wanted to streamline what was offered because what we had being two separate systems that offered some things that were similar but not exactly the same was confusing to patients, and it was a little bit confusing to us sometimes about who did what and where. So we developed a process to combine our programs, and what that ended up looking like is that what was once separate management structures at Research Park, now known as Science Drive Clinic, and what was once a Center for Wellness over at East Madison Hospital, we now have a shared management structure. And we have Diane Scherschel, who is currently the manager of the Integrative Health and Wellness clinics or program. We have Diane Leahy, who is the manager of the Fitness and Aquatics programming at both locations. And we have Julia Pitts, who is Integrative Health Clinic Coordinator. Many of you might know that as Mike Johnson's old job to help support the acupuncturists, massage therapists, the healing touch providers, and at one point Feldenkrais. David Kiefer remains the medical director of the Integrative Health Consult Clinic at Science Drive Clinic, and the medical director of the Center for Wellness at East Madison Hospital. Phil Swain is our director for both clinics and now this one program. And so as we shared the management structure, we also felt like each clinic also had a lot to offer on its own, right? And so we wanted to make sure that voices from both programs as we merged were well represented, and we felt like the obvious next step was to create a shared mission and vision. And so while we're not, we really just wanted to talk with you and have you meet our leadership team, really wanted to just share um, that document that came out of both the meetings that the leadership teams had, but also in the fall of 2021, we asked our integrative health community to also give some input about what's most important to them, what's most important in this work, both for what we do to serve others and also what's most important to keep us fulfilled as we engage in this healing work. And so I'd like to just share that document. Um, And this is the shared mission and vision that came out of that collaboration of the integrative health and wellness programming. So I know you can read it, but I think it's important just for us to share together the words of this mission. And our mission is now through the principles of integrative health and participatory medicine in our compassionate care, education, and research, we will support the individuals, communities, and healthcare system we serve on the path to their greatest well being. And our vision is to become a trusted academic and clinical resource for compassionate, innovative, and evidence based services to achieve whole person and whole community health for all. As we work towards that mission and vision, we'll be guided by values of compassion, diversity and inclusion, innovation, integrity, accountability, respect, and excellence. And here These documents will be made available to you all after today's meeting. But we just wanted to make sure that you knew that your input was gathered in a way that is now a permanent part of what our combined programs are. The next step in us combining those programs after we developed our mission and vision was to decide how we would do this work. And in doing that, um, we developed 6 working groups that were divided into the different areas that we wanted to focus on. And those working groups were centered largely around some of our group medical visits. Both we had a group working group that we developed for group medical visit coordination. We have a group medical visit evaluation team. We have a working group for education, for community outreach, for clinical services, and for marketing and communications. In a little bit, you're going to hear from leaders from each of those working groups to give you a sense of what has been done in that realm. But before we do that, I also just wanted to touch base on the fact that we are now, through a very generous gift from the Osher Foundation, which is a philanthropic organization out of San Francisco. They gave us a gift of about $5.5 million to help support the work that we do. That also came with us being part of an Osher collaborative of academic integrative health centers. We are now colleagues through that collaborative with academic centers such as Northwestern University, Harvard, UCSF, University of Washington, University of Miami, and several others. You'll be able to, after this meeting, we will send out a document that gives you a link to the Osher Collaborative so you can learn more about that if you'd like. And lastly, because we are an Osher Center, that center designation means something very specific within our academic institution. And because of that, and because of all the work that we've done and the great potential of our program, we were encouraged by the dean of our medical school to apply to become a university recognized center. What that means is that we have not only a presence within our health system, but also a presence within the university. Though being a center allows us a much more ease and collaboration with other aspects of the university that have expertise, knowledge, and efforts at helping support wellness and health within our communities. Our community outreach working group has probably the most close ties and potential with collaborating with other areas of the university, places, entities like the College of Agriculture and Life Sciences and some of their nutrition and farm to table programming. The School of Human Ecology does outreach in communities and does some work with families and mindfulness. The Department of Counseling Psychology has a bilingual certificate program, and they work with Centro Hispano. So these are all entities across the university that as a center, we'll have much more ease in collaborating with to seeing what we can do at a greater level. So that's sort of the high level overview of the things that we've done. I'm going to turn this over to my colleagues in integrative health and the leaders of those working groups to give you a little sense of some of the specifics of the work we've been doing over the last 2 years. So Alyssa, would you mind telling us a little bit about the group medical visit coordination?
Yeah, good morning. Can everyone hear me okay? Okay,
Yes.
perfect. Thank you. Yes, so my name is Alyssa. I am a co-leader with Dr. Lisa Grant as we lead the coordinating group medical visit working group. As I want to start our brief time here together, a review of the high-level goals that we've identified as a part of the coordinating working group. We have 6 in total. Our first was to enhance provider/community awareness of GMVs. Ultimately, we wanted to answer the question that we hear often, what are group medical visits? The second, increase patient recruitment and enrollment in GMVs. The third, expand the geographic reach of GMVs. Fourth, create a culture of salutogenesis, ultimately developing a continuity of care process. 5, ensure provider compensation with the goal to decrease burnout and ensure program sustainability. And the sixth goal, learn to understand what patients want and need. Ultimately, we wanted to identify a need for conducting a needs assessment. With that being one of the elements in our top high-level goals, we chose to move forward with the needs assessment, recognizing that that was our top priority. We are meeting monthly, mainly virtually, to discuss how we wanted to approach the needs assessment as our top level high priority goal. There was a fine balance of funding, effective, inclusive survey with meaningful insight, and ultimately a low barrier to application. Our intention with that needs assessment is to gather quick, high-level patient data from multiple geographic locations. And what we are currently working on, later this week we will meet, are edits from our needs assessment from the UW Survey Center. So ultimately, we're going to take some feedback and improvement from their comments and see where we can best implement a needs assessment survey. So those are our next two top of mind elements for our coordinating GMV working group. And I wanted to add one more thing to the conversation here. One of our high level goals, as previously mentioned, was the need to increase GMV awareness, recruitment, and enrollment. With that, we developed two SMART phrases, or previously known as DOT phrases, in HealthLink, the medical record system, to help promote GMV awareness. So providers, clinicians, etc., can utilize two DOT phrases, GMV recommended and or GMV flyer, to help promote patient-facing materials and get the word out there. Thank you. Of
Thank you, Alyssa.
course.
I'll also say that I know that the working group has been supportive of other providers learning how to do group medical visits, both within the Center for Wellness and uh, ready to help folks, support folks in developing group medical visits in their own home clinics and spaces. Thank you. Sarah, would you talk a little bit about our group medical visit evaluation committee?
Sure. Hi, everyone. My name is Sarah, and oops, I just lost my notes. Hang on. I have had the privilege of co-leading the GMV evaluation working group. I co-lead that with Dr. David Kiefer, and our group also includes Dr. Tom Walhouse, Dr. Lisa Grant, Diane Scherschel, and Alyssa, who just spoke with us, Alyssa Bobo. We developed 3 goals for our GMV evaluation group, and the first was to develop a generalized patient survey that can be utilized by different GMVs. We also would like to develop a protocol for how to implement the survey once we have it in a GMV setting, so we have consistency across GMVs, and to develop a standardized data collection, analysis, storage, and reporting protocol. So really our first step was to look at different patient surveys, or to, I think some have been used, like the Promise 29 in various GMVs, and we recognize that a lot of these surveys weren't really giving us the information that we were seeking from patients in this very specific group medical visit setting. So we decided to develop our own. And so for the last 5 or 6 months, we as a group have been working on developing a generalized patient survey that can be used to elicit feedback from patients as a tool for not only quality improvement of our many GMVs, but also as justification for the time and investment in these great methods of patient care and education, and also to potentially gather data for publication. So we developed 6 categories that for this survey that include how the GMV impacts lifestyle change and health promotion for patients, education, or did the patient learn useful information, group support, how was the GMV specific, that group format, helpful to support the patient, engagement, did the GMV encourage increased personal engagement in a patient's own health behaviors? And then the last 2, provider satisfaction and patient stories and testimonials. We're hoping to be able to gather stories and testimonials that we might be able to share to also help promote the group medical visits. So the state of the survey is that we're currently, we developed a survey with a number of questions. We're currently working with survey professionals at the UW Survey Center that are helping us to understand best survey practices to increase the accuracy, the reliability, the validity, and also increase the response rate for the survey. Some of the ways they're helping us are to help us know how to best word questions, what are the most appropriate response formats, the best ways to present rating scales, and so on. And so our work in the next couple of months here will be to go back and forth with the first draft of response from the Survey Center and provide edits back to them, and hopefully in the next few months have a finalized survey that we can then use to gather information from patients.
Thank you, Sarah. Vinny, would you mind talking about updates in education?
Yeah, sure thing. Thanks, Greta. Good morning, everybody. I'm Vinny Minichiello. It's good to see you all. Thanks for being here. So a few brief updates on the education side of things. First, I just want to call in Sarah Arscott and the work that she has been doing to update our integrative health website. Amazing resources. Honestly, this was the website that drew me to Wisconsin initially, was seeing all the handouts and resources we have for patients there. So Sarah has been doing a fabulous job updating that. If you haven't had a chance to look at that, that's been a big part of the education movement that we've been going through. The other big piece is in my role as fellowship director, applying an equity lens to our program. And so this has taken several different approaches. First and foremost, with curriculum, we've been updating the curriculum so it's current, relevant for the fellows, and really trying to condense it, make it into like the core knowledge that fellows need to practice integrative medicine, to do research in integrative medicine if they'd like to um, uh, just have a good sense of how to pass the boards exactly too. Um, the other key piece of updating the curriculum is applying this equity lens. So between Sarah Arscott, me, and Dr. Suhani Bora, she's the fellowship director at the Greater Lawrence Family Medicine Center in Massachusetts. The three of us have been working together to go kind of module by module, unit by unit through our very extensive fellowship curriculum to update the objectives, update the assignments with that equity lens. Also really grateful for the support of the DEI committee in our department here to kind of guide us and provide some insight about how best to proceed. In addition, continuing to work on recruitment, we currently have 4 integrative health fellows, including 2 faculty members that are going through the fellowship. And in this summer, we'll have another 3 fellows that'll be joining us. And again, the intention that we bring to the recruitment process itself is to really try to draw upon people that have a passion and interest of anti-racism as it plays a role in the field of integrative medicine. We're working on developing a more robust mentorship and evaluation process for our fellows so they may be as supported and as prepared as possible in their professional development. 2 other pieces. One is looking at clinical experiences of our fellows. And one of the initiatives that we are in the process of working on is partnering with the Winger Clinic. So the hope is that this upcoming July, we will start to develop a clinical presence and partnership in the Winger Clinic to provide some integrative medicine consults, potentially group medical visits, and kind of other resources that serve that community. And finally, speaking of community, is partnering with community. And so we've been thinking about how best to do that. And one of the opportunities that has shown up for us is partnering with the Hmong community in Madison. And so we've been in discussion with the Hmong Institute and working on developing seminars and trainings, not just for the integrative health program, but actually also for the department as a whole. So that will be TBD. And I'll pause there. Thank you all.
Thank you, Vinny. Phil, would you mind talking a little bit about our clinical services?
Sure, I can give an update on the clinical services. I'm not actually on the council of this one. Greta, are you able, if I can give a current state of affairs with the services, but Greta, are you able to provide maybe an overview of what the council is working on or the committee?
Yeah, so why don't you go ahead, Phil, and I'll fill in if we need to.
All right. I will at least provide a quick update on integrative health services, let you know where things are at, and I just really proud to report the progress that is being made in our integrative health services through UW Health. I think most of you are aware that integrative health services were kind of ground to a halt, at least in many respects during the pandemic, and just really great to see the growth that's occurring in and around our integrative health services. We've hired new acupuncturists, we've hired new massage therapists, and our clinical volumes are now back to pre-pandemic levels. We've seen strong growth at both Science Drive and East Madison locations, and need to really credit Diane Scherschel with a lot of this growth and development here with our integrative health services. Just been remarkable. Our aquatic and fitness programmings has also ramped up and seen similar positive growth. And our mindfulness offerings continue to grow and expand. And again, crediting Lisa Thomas Prince here, but we've really started to develop some new curriculum specific to certain populations. So in addition to our flagship mindfulness-based stress reduction class, our programming has also grown to include offerings specific to youth, grades 8 through 10, parents, people of color, all kinds of really great new innovative mindfulness programming out there. And of course, still offering some drop-in sessions and practice sessions via Zoom, which has been really well received. So a big thanks to Lisa Thomas Prince for thinking outside the box with our mindfulness programming. So really great to see that as well. And just my final update here on integrative health services. We are really thrilled to once again be offering OMT in our integrative health clinics. This has been a gap in our services for quite a while, and really thrilled to have Dr. Dudek and Dr. Sullivan on board providing those services, and hopefully adding maybe even one or two more providers here over the next year. So really thrilled to see a lot of growth and development in our integrative health services, kind of rising from the ashes, so to speak, of the pandemic, and in my opinion, stronger than ever now. And so I don't know, Greta, I'll maybe let you speak to some of the clinical service coordination discussions occurring with oncology or GI, but really great to see some of the services rebounding from the pandemic.
So really briefly, over the last year or so, we have developed a mini subspecialty clinic where Dr. David Kiefer and Dr. Ravi Kirkatur also are providing consult services for patients with inflammatory bowel disease, and that was a joint venture with our GI colleagues. We are currently in discussion and reimagining what our work and collaboration might look like with our oncology colleagues. And the inpatient work that we had was put on hold, and that's an area that is another place where we can start sort of reimagining what it might look like and what we can offer as well. Kathy, would you mind talking to us about the Marketing and Communications Working Group?
Sure. Good morning, everybody. I am Kathy Mike, and I'm Marketing Manager for Integrative Health at UW Health. And so the Marketing and Communications team consists of Diane Scherschel, Diane Leahy, Peggy Kelscher, Phil Swain, and myself. And then we've done a lot of collaboration with the department. So I just want to start out by saying this is really an exciting time. And with each person reporting in, I can start to see the vision and the shape of what we're creating. And what's really cool is that we're pulling from our existing shapes, knowledge, information to create this new entity. And having a vision around it is really important as we do that work. So the communications and marketing group had 3 priorities. I mean, you can imagine all that's available for us to focus on, but we really wanted to focus on those 3 objectives. And so one thing that's really important is, how do we talk about ourselves? Is really important for our team, for our patients, and for our community. And so while naming a program sounds really easy, it takes a little bit of time to do that. So again, the objectives were branding, or how do we name the programs, program integration, how do we come together with our existing programs, and then how do we communicate about it and how do we talk about it so people are nodding and saying, I get it, rather than scratching their heads saying, what are you talking about? So regarding the naming and the branding, trust me, we did a lot of assessment. We compared we have a spreadsheet if anyone's into that, all the different OSHA centers and how they talk about themselves, because there's clinical programs, but then there's also the department side, and how do we bring that together in a way that makes sense. So just as far as how we talk about clinical programs, it's UW Health, Integrative Health and Wellness, with a link to the OSHA content on the DFMCH site. The department, the official name for the integrative side of things, is OSHA Center for Integrative Health at UW-Madison. So a big shout out on getting that done. And again, I'm sharing that with you and emphasizing it so that we start speaking the same language on some of these. Program integration is the next thing, right? How do we bring together integrative health and wellness, and then the department, and then our integrative family medicine programs? And so that is in progress. But as we inch towards understanding around that, we are updating materials for that. So some of our accomplishments are, we've brought together content on uwhealth.org from both integrative health and wellness. So when a patient's there, at least they can see the information for all of our offerings in one place. And as programs continue to come together, we'll be updating that. And then the other exciting piece is, we can't forget Swedish American, which is really now UW Health Northern Illinois. And one of our fellows, I believe, correct, Greta, is there. And Dr. Shravani Sridhar. And so she also is listed on the site, and we're bringing her into the process and some of the services there, and keep them in mind as a place where we can bring some of our services together as well, or offer them. Part of expanding out is sharing in that way, especially because we can do a lot of things virtually. And then finally, communication integration. So we had a great announcement about the grant. We're preparing information announcing that we are now an official center. We're working together, I think, more closely with the department side as well as the clinical side on how we talk about things. I mentioned the website. We'll also be updating print, signage, social media, those kinds of things. And then coordinating that online communication between, again, how do we make sure that whether somebody lands on information on the department side or UW Health, they get it. So that's pretty much an overview of the 3 things we're focusing on. And again, it's ongoing. And so we're still forming and creating the communication around it.
Thank you, Kathy. It's a big process, to be sure. David Kiefer, would you mind updating us on the Community Outreach Working Group?
Hello, everybody. Really great to see all of you, and Happy New Year. What an amazing turnout. And I wish, speaking of community, that we're all in the same room together, probably a large room. I will try to humbly summarize the work that we've been doing in this committee with Dr. Kufal, Lisa Thomas Prince, and myself. And also, just, this has been so great to hear what everybody else is doing in detail, and it's an honor to be a part of this. And there's a lot of overlaps. Hearing what Dr. Minichiello is doing in the community certainly resonates with what we're trying to do. So I guess just a quick summary, and then I know we're going to go into breakout rooms, which is going to be a really neat part of this too, to hear from you all what you think, and maybe bring some new ideas to the table. With respect to integrative health in the community, this has certainly been on a lot of our minds. And just like Kathy was saying about existing connections, certainly a lot of us think about integrative health in the context of how to bring this to populations and communities that don't often have access to our services or our experience. So that's been the forefront of what we've been talking about over these months in our meetings is what would that look like to, offer, our service, our clinical services or education to communities throughout Wisconsin and beyond. And also what we've been talking about is this idea that a lot of what constitutes integrative health certainly has underpinnings throughout the world in the global community, whether it's traditional Chinese medicine or meditation practices or herbal medicines. And what does that mean to think about integrative health in the context of more global health and really going beyond the walls of our clinic or maybe the university community? So these are things that we've been talking about, trying to really draw on connections that we already have, and then to do basically a lot of listening. So we may think that it's important to share nutrition with a certain community and later learn that they're fine on that front and they would prefer something else. So I think we've been meeting with a lot of groups, individuals, community organizations, and just sitting back as much as we can and learning what they might like to do. So that's kind of where we're at. And like Greta just said, this is certainly a process and evolution, which will hopefully continue in the breakout rooms. We want to continue to do some listening and see what we can do to offer our services and thoughts and experience for community members.
Thank you, David. All right. So what we really wanted was a chance to maybe answer some questions or maybe get some input from all of you. So the next part of our time together, Sarah Arscott's going to help us go into, you can choose a breakout room, and there'll be 4 breakout rooms, and we'll do 2 sessions. So 10 minutes, and you can pick from 4 options: community outreach, group medical visits, education, and clinical services. And there will be members of our team in each of those sessions to listen or to answer questions if you have them. So again, we'll go about a 10-minute breakout room, and then in one of those 4 sessions of your choosing, and then we'll switch. So you'll have an opportunity to go into 2 separate breakout rooms in succession. And then we'll just come together at the end for a minute or 2 to wrap up. Welcome back, everyone. Hope you had a chance to have some discussions and get some feedback from our leaders. Our leadership team got some feedback from folks. But your input and your interest in what we're doing is greatly appreciated. After this meeting, we'll make sure to send out the recording as well as sort of a document that maybe gives a few more details that you can look at your leisure if you're interested in collaborating with us, and that'll include a few resources about where you can go to get more information as well. But the Integrative Health Program, Integrative Health and Wellness Program, is very interested in integrating everywhere. So come if you have thoughts about collaboration, come to us. We're grateful for your input. We're grateful for your presence. We're also grateful for all the work that you're doing in collaboration with us specifically, or in collaboration with us as a general community of like-minded people. I want to invite you to our next grand rounds. On February 1st, we're having Dr. Christopher Nicholas join us to present an overview of clinical applications of psilocybin and MDMA assisted therapy. There's a lot of work being done at the UW here. It'll be a really interesting talk. Hope you can join us. If you can't, we'll make sure to record it so you can watch it at your leisure. But again, I can't tell you how grateful I am personally just to be in this department and in this program. And as a group, we're grateful for all your presence and your input. So thank you all very much. Have a lovely